This question is asking us, which of the following drug classifications is primarily used for pain relief? So when we're looking at drug classifications, it could be helpful to remember your roots and your suffix. The root being the main key part of the word, which is telling you its meaning, and the suffix is an extra add-on to it that might tell you an action of that meaning. For example, cardiomegaly would be relating to the heart, which is the root, and megaly is the enlargement that's happening to the heart. So let's look at the choices and see if we could identify any of these roots and suffix. So if we look at the first choice, analge. Analge means to be in a painless state. Painless. And so an analgesic is a medication used to reduce pain, or in this case, to cause pain relief. And sometimes you might even see in a patient's chart, if they have a high pain score, you might see another line stating analgesics used to combat pain. So it's looking like the analgesic is the correct choice of the drug classification used for pain relief. So we will go with choice A for now, but let's look at the other choices to understand what these options mean. So if we look at hypoglycemics, we could look at the beginning of this word, hypo. So if you think of someone who's really hyperactive, let's look at that word, hyperactive. That would mean that they're very active, a lot of activity. So active is what they're doing, and the hyper means it's a lot, increase, hyperactive. So if we understand a hyper means that it's a lot, like in the word hyperactive, then we can remember that hypo means low. You could even think hypo, low. So something in this example is low. And if you look at the other word, glycemics, glycemic is referring to glucose. So if we put it all together, that means low glucose, hypoglycemic. So that means that this medication, its use is to lower blood sugar. Glucose is sugar. So hypoglycemic, low blood sugar. This medication lowers blood sugar. But this question is asking us about pain relief, so we know that we can eliminate choice B. Option C is a diuretic, and a diuretic is used to increase the amount of urine leaving the body to lower the amount of fluids. And it's often used to reduce blood pressure because reducing the amount of fluids in the body in the form of urine, flushing it out, lowers blood pressure. And that's a great use for that medication, but this question is asking us about pain relief. Diuretics are not used for pain relief, so we could eliminate choice C. And then choice D, over-the-counter. Over-the-counter is a general term for medications or any sort of pharmaceutical that you could just buy in a store from a shelf. You don't need a prescription. You don't need to have a pharmacist dispense it to you. You could just get it in the store. And a lot of pain relief medications could be over-the-counter, such as Tylenol, Motrin, Advil. However, there are lots of other medications as well that could be over-the-counter, such as vitamins. Sometimes you could get a hand splint over the counter. It might not necessarily be a medication. So for that reason, we can eliminate choice D. And that leaves us with our first choice, analgesic, pain relief medication, choice A.